So thank you guys for coming to the diabetes awareness event. This is a really important topic that needs to be discussed. It's diabetes is really relevant in our everyday society. So thank you guys for participating. And yeah, we're doing this with Student Health Services and with ASI. So hopefully you guys enjoy. Can we skip to the next slide? Awesome. So these are where the introductories come for the guest speakers today. And my name is Destiny Izas. I'm the Commissioner for Disability Affairs on campus, and I'm personally affected with diabetes. I am a type 1 diabetic and have been for the past 4 years. So I live with diabetes and I have been managing my blood sugar levels for a while. I actually got diagnosed really closely when my brother got diagnosed. So a lot of my family members have also been affected by this as well. And then the next speaker will be Rosemary. If you'd like to introduce yourselves. Oh, you're on mute.
Hi, my name is Rosemary Tillman-Kellum. I'm a physician assistant and I have worked as a PA for 28 years now. I currently work at the Student Health Center, and this is a wonderful place to work, and I look forward to sharing this very important topic with everyone with Destiny.
Hi, everyone. I'm Emily Parker. I'm a registered dietitian. I've been a dietitian since 2008, so a little over 13 years. I also work here at the Student Health Services at Cal State Long Beach, and I actually have two close family members with type 1 diabetes, and I've worked with youth with both type 1 and type 2 diabetes. So I have a lot of personal and professional experience with management of diabetes, and I'm looking forward to sharing with you today.
Hi, my name is Heidi Gerling. I'm a health educator here at Student Health Services at Cal State Long Beach. And I've been personally impacted by the disease of diabetes. My entire family has diabetes. I don't have it yet. I'm trying to prevent that. But I recently lost a brother to diabetes related problems. And so this is a passion project for me, and I'm really excited that we get to share this information with you. So thank you so much.
Thank you. So the first presentation slide is just what is diabetes? So a lot of people that you may know probably don't know what diabetes is. So diabetes is actually a group of diseases that affect the glucose within your body. So glucose actually is energy that you get from the food that you eat. So when you have diabetes, that affects the insulin production that you have within your pancreas. So your pancreas either creates very little or no insulin when you have diabetes, whether that's type 1 or type 2. It's a chronic disease, so usually it lasts more than 1 year or it's lifelong. It's really important that monitoring and medications are used when you're diabetic, because you could have elevated glucose levels, which is hyperglycemia, and that's when your glucose levels are above the regular glucose level. And the drop of glucose levels is hypoglycemia, which is when it drops to dangerous levels where you could actually pass out. And to the left, you could see the glucose machines and the blood test strips that diabetics use. So this is a presentation of kind of what happens when you eat food and the glucose that goes through your bloodstream. Insulin is what helps the glucose get through your bloodstream into the cells that need the energy to survive. So when you eat food, your pancreas creates the insulin that allows the glucose levels and all the glucose to go into the cells. So that's just a little presentation of what really happens in your body when you have insulin. So hopefully this doesn't scare anyone. This is more of just to bring awareness of what puts you at risk for diabetes, or your loved ones as well. So racial and ethnic groups are at higher risk for type 2 diabetes, as well as just your family history. It could be gestational diabetes. When you're going through pregnancy, you could also get diabetes in that way. Or when you have an inactive lifestyle or eat foods that are are not good for you, as such as fast foods, and foods are very high sugars and all that bad stuff that we shouldn't be eating. And I think there was another bullet on here. But anyone could have diabetes at any given time. Sometimes it could be very sudden, or it could gradually become, apparent in your body when you have diabetes. Oh yeah, you could change the slide. And the complications and future risks. So when diabetes are not controlled, or you're not taking care of your diabetes, a lot of complications could happen and could even create more health problems than you already have. So the main thing is nerve damage and nerve pain. This could be within your body, and it could be very painful if not treated correctly. It could damage blood vessels and have kidney failure if not treated correctly, and you don't take the insulin that you need for your body to survive. High blood pressure kind of ties along with the diabetes as well. So that's also another really dangerous chronic illness that could happen if you don't take care of diabetes. And the very worst outcome could be amputation of your legs or your arms if your blood sugars are not in check and in level. And yeah, again, hyperglycemia and hypoglycemia could happen if you don't control your insulin levels. So if you have a really high glucose level, you could potentially be at risk for either passing out or in worst case, death. And the same thing with hypoglycemia. When your blood sugar levels drop, you could also pass out. But there are many ways to take care of yourself before that actually happens. And diabetes could be treated if you have a good medical plan with your doctor and your endocrinologist.
Okay, I'm going to talk a little bit about the prevalence of diabetes in the United States. And so what this slide here shows, this is a percentage regarding our population in this country, and total diabetes rates have increased since 2001. Between 2017 and 2020, which was the last data collection period, you can see here that the rate of diagnosed diabetes has increased to more than almost 8% of the population, and total diabetes includes both the diagnosed and the undiagnosed cases in this country, but steadily increasing in this country and globally as well. And understanding that the cost of diabetes is staggering. And this slide comes from the American Diabetes Association, which is an excellent resource. What we know is that approximately about 4,600 Americans are diagnosed with diabetes every day, and nearly 30 million Americans have diabetes. The estimate for pre-diabetes, so people that are have not yet been diagnosed and may start to show signs and symptoms, they're estimating that it's about 86 million people. The cost of diabetes for this country is about $322 billion per year. So that equates to about 1 in 5 healthcare dollars that's spent caring for people with diabetes. Medicare, which is a government healthcare program for people 65 and older or with kidney failure, 1 in 3 Medicare dollars is spent caring for people with diabetes. And finally, understanding that people who are diagnosed with diabetes have healthcare costs that are 2.3 times higher than if they didn't have the disease. So understanding that the cost to the individual and of course the cost to society is increasingly a problem for this country and around the world.
Okay, I'm going to go over the types of diabetes. A very good presentation by Destiny, and she explained what diabetes is. However, there's 2 types, and they're very distinct in how they present and how they're classified, and that's type 1 and type 2. And as you see, the onset with type 1 is all of a sudden. And so these patients actually present and they have no pre-existing anything to explain why they have developed all of these symptoms. And the symptoms basically will direct you as to how to test these individuals to get to that diagnosis. But type 1 is less prevalent, but it doesn't mean that you're not going to find anybody with diabetes. If you turn to your left or right, you may find that someone on your side actually has diabetes, or they know of someone that has type 1 diabetes. It's genetic. It can be autoimmune or idiopathic. They really don't know why did it occur, which is one of the frustrating things with type 1 diabetes. And the symptoms, sometimes some are a little bit similar to type 2, but pretty much because they don't have any kind of reason as to develop these symptoms, and they're thirsty all the time. They go to the bathroom a lot. They're urinating, meaning they can go urinate several times in an hour, or get up in the middle of the night multiple times and urinate. And that's really unusual. And despite eating, they're hungry all the time, and they're eating plenty of calories, but yet they're losing weight. And then as well, some of the common side effects they present with the vision and the fatigue. And then for both, you can basically get the glucose in the urine, but with some of the other symptoms listed here, you will be able to attribute this to type 1 with the glucose in the urine if they have no reason, it's sudden. And then as well, look at the age. The age, it used to be type 1 was juvenile diabetes because it occurred in really young children, young adolescents. But now we're finding that type 1 diabetics can develop in their 20s, and not really knowing why all of a sudden their pancreas no longer works. But that's one of the defining factors when you're looking at the difference between type 1 and type 2, where type 1 is like your pancreas just stops working all of a sudden and doesn't produce any insulin. In type 2, you do. And if you look at the bottom, that's what determines mainly what's type 1 and type 2. One is insulin producing and one is not. And in comparison, when you look at the type 2, it's gradual. You're going to find a person that at first their labs suggest that they are having some glucose intolerance, or they might not be metabolizing the glucose within a reasonable amount of time. And over years, it actually gets worse and worse. So that is a deciding factor whether you're type 1 or type 2 as well. Like I said, onset with type 1 is just all of a sudden you're going to the bathroom, you're thirsty and all of this stuff. Well, you're thirsty and go to the bathroom with type 2 as well. But like I said, when you first initially present, you're like maybe a little bit unable to metabolize glucose in the amount of time that's expected. And this is the one that's more prevalent. And as well, this used to be called adult onset diabetes, but no longer, because we're finding that where children have type 2 diabetes. And so you can't really say by age whether a person has type 1 diabetes or type 2. We were given a general overview of what diabetes is. However, you just can't determine by age whether it's type 1 or type 2. And then the approach to treating type 2 is a little bit different as well. Usually you can start off with trying a diet and exercise with individuals to see if they'll be able to lower their sugar level or their glucose level. And that's another thing. There's a lot of older populations that call diabetes sugar. So when you say, oh, I got sugar, it's like they have diabetes, so, or their inability to metabolize the glucose. But that's where you start with the diet and exercise and weight loss, because just 5 to 10% weight loss in a type 2 diabetic could help you to manage your glucose level without any medical management. And ultimately, if that doesn't work, then you start off with medications. And that's a big difference between type 1 and type 2. Type 1 is that you have to replace your insulin with injectable insulin, whereas in type 2, you don't. And so the production could be normal, decreased, or increased, and that's kind of determined by the testing that's done. Next slide. So like I mentioned, you're going to urinate often. And that's kind of like the presenting complaint. It's like, man, I get up every night. I used to sleep through the night. I'm getting up not once or twice, but 3 or 4 times a night, and I'm urinating. And as you know, in small children, you absolutely know this is really abnormal when a child is having a lot of urination at night. Monitor them a little bit more in the day, and you'll notice they're going more frequently as well. And they're drinking a lot of water, and they're still thirsty. And like I said, you actually will have a significant weight loss if your sugar is out of elevated over a prolonged amount of time, or your glucose level. And so people, they can present with like the neurological symptoms when you have it out of control glucose level for a prolonged amount of time. And that's when you can get the numbness and tingling in the fingers or the toes. It can affect your vision. And at that point, you know, you may be having some what's called the peripheral neuropathy, which is the small vessels within the fingers and the toes. And you start having these symptoms, which could cause a person to present to the doctor as well. And so for whatever reason, elevated glucose level causes people to be tired. It affects their skin, is dry. A prolonged healing, you get a sore, and for whatever reason, it takes forever to heal. And those are like really subtle symptoms that you don't even think about could be diabetes, but people do present with those symptoms as well. And the last point here, it's a really important point, especially in females. They'll present more frequently with female issues, frequent infections. You'll get vaginitis or UTIs, and more frequently than usual. And that'll trigger as well you to be tested more frequently to see if you have elevated glucose in the sugar, elevated glucose in the urine, as well as elevated blood glucose levels. So how do you find out if you have diabetes? And that's something that I already mentioned, because you present with all of these symptoms and you just don't just assume that an individual has diabetes because they're going to the bathroom a lot. But basically, like I said, it doesn't matter the age. There's type 1, type 2, they both can present with frequent urination and being thirsty. But typically, some of the basic screening labs is the urine. And in most instances, when you're first diagnosed with either type 1 or type 2, you're going to have elevated glucose in the urine. So that in itself, as just a simple screening test, is going to trigger you to do more of the blood test. And what's real popular is the hemoglobin A1c, which many have learned that this monitors how well you're controlled over a significant amount of time. So, 30, 40 years ago, people would get their fasting blood sugar or their fasting glucose level checked, and then they would not eat for a whole day. So they'll go in and try to fool the doctor and assume that, oh, my glucose level is good, but they haven't eaten in 18 hours. But now with the hemoglobin A1c, you can't fool it. So it does check your sugar or your glucose level over the last 3 months. And there's even one that will test it over like the last couple of weeks as well. And those are more dependent as to whether you have the diabetes and how well you're controlled. So those are the cornerstone for evaluating your diabetes. So if your blood glucose or hemoglobin A1c levels are elevated, then you're treated. You start treatment, and you're going to be referred to an endocrinologist. And part of the coordinated care is a nutritionalist or a dietitian. So that's important part of the management of diabetes, because once you determine that you do have it, whether it's type 1 or type 2, You need to learn how to eat properly and keep your glucose level maintained at a proper level. And the monitoring, I'm going to turn that over to Destiny, who has a personal experience with what she has went through and how to monitor and treat herself.
Thank you, Rosemary. Yes, it's very important to know if you have diabetes or not and the different methods of how to test if you do, because that determines the treatment that you're going to be receiving when you are diagnosed with diabetes. So I started losing weight. I remember at one time I was urinating a lot and at night, and I was like, why is that happening? So that's when I went to go to diagnostics, and that's when they diagnosed me with type 1 diabetes. When I was 20 years old, I'm like, oh my God, so what exactly, how do you treat diabetes? And there's so many different things to consider when you see the medicines and all the treatment options for diabetes. So some diabetics use metformin or pill-based medicines. My grandma doesn't use insulin injections. She does use the pills, and that's different from me because I actually use the injections that you guys see in the pictures right here. So the very top left picture is actual finger prick stick that helps you take the blood out of your finger so you could put it on the actual glucose level blood machine, and you can see a little number 120 on there. So that's how much the blood glucose level is. I don't use that anymore. I actually use a Dexcom monitor for it, so I have it right here, so you can actually see my glucose levels as of right now, and it's 24 hours, so it keeps on going. And then I also have here Insulin Pen that I use at least 3 times a day. This is the fast acting Hemoglobin Pen. And usually when I use it, I have to consider the different factors of what did I eat, what time do I eat, how many carbs am I eating, and that determines how much I use. So sometimes it's also measuring how much you need to put in insulin, because if you put too much, you might drop in blood sugars. And if you put too little, it's going to elevate your blood sugar. So it's really important. Some diabetics probably use this, but I know my doctor recommended me to have it. This is Atlantis Pen. This is a pen that goes 24 hours. So I usually put it on at night. So I don't know why my blood sugars spike at night. So my doctor actually recommended me to do the injection at night, so my blood sugar levels stay at 100, 120, and the range levels are more healthy for me, because you could get very sick if your blood sugars are either really high or really low. And yeah, so you see the picture with the phone and the little circle on her arm. So that's another device that is also, it's a adhesive that you put on your any part of the fatty part on your body, and it could tell you the blood sugar levels that you have currently, and you could connect to your phone, or like I had just shown you guys, another machine that kind of shows you your glucose levels. There's another type of injection. So you see right there the syringes. That one's a little bit more, in my opinion, it was harder for me to do at first, and I was struggling with this, so that's why I switched to the quick pen. But for those, you get the insulin bottle and you put the injection in, you have to measure it yourself, and you have to make sure there's no bubbles. That part always used to get me so frustrated. So you have to be careful when inserting that, because it could be dangerous if you don't calculate correctly. And the bottom left is the actual insulin pump. So for those that are eligible to get it, or if they're eligible to purchase it, you could actually put that on your body, and it calculates your glucose levels, and they kind of adjust it, and they give you insulin without you having to inject yourself. It just stays on your body for, I'm not sure how many days it stays on your body, because I haven't personally used it, but people get to use it, and it automatically puts insulin without you having to calculate or inject yourself. And yeah, I think on the right side is just a mixture of different things that you see. So the blood glucose monitors, the injections, the pens. And I think this is a newer one, so I also have this as well. It's called Baqsimi. So when your blood sugars drop and they're at dangerous levels where you could actually pass out, it's a nasal powder that goes into your nose, and you could actually be okay. So it's kind of like a quick remedy to help before you actually pass out when you have low blood sugar levels. And 2 more things I could show you, just because if you guys are curious about different machines. So this is a transmitter that I have on my body right now. So that kind of shares the glucose levels that I have currently that go to my Dexcom. And this is a sensor that actually, it gives me the adhesive of my body. So it's kind of like a little gun that you press, and it puts the adhesive, and then it puts a sensor on your body, so it could be connected to the Dexcom monitor. it's a lot of different stuff that the diabetic industry is kind of like creating to help regulate our blood sugars like more rapidly and more accurately. But sometimes it's occasionally you could use a finger prick because that's one of the most accurate machines that you could use for your blood sugars. But yeah.
Thank you, Destiny, for sharing that. I really appreciate that. So I want to talk a little bit about the cost of treatments because medications and equipment can be very expensive, and the cost of insulin in the United States is higher than any other developed nation. This image comes from the RAND Corporation, which is a think tank, and they evaluate healthcare utilization and cost around the world. And this is from 2021. So the average price per unit across all types of insulin in 2018 in the United States was $98.70. And as you can see below here, Japan was at $14.40, Canada at $12, Germany at $11, France at $9.08. UK at $7.52, and Australia at $6.94. So when we add up the costs for an individual, but also if you have health insurance or if you are using a government program like Medi-Cal or Medicare, these costs basically they add up very quickly. And a really great point here is that when we talk about that, an average fast acting pen that Destiny had showed us, those pens have about 300 units of insulin in them. And when a diabetic has to inject themselves every meal, 3 times a day, think about the cost and usage of just one pen. So if you had 18 units times 3, that equals 54 units used per day. So if you follow these directions as your doctor would prescribe, this one pen would last you about 6 days. So you're spending almost $100 every week just on insulin. So living with diabetes is it obviously, as you've heard, has included a lot of different things, that it's not just, oh, I have this diagnosis and I shouldn't eat sugar now. You have to do all types of things like the monitoring, but learning some healthy coping skills can be very helpful. That might mean including more time for self-care and rest, and finding ways of managing your emotions regarding this situation and having the diagnosis. Healthy eating is very much a part of this. What we put into our bodies is our fuel. And in a moment, we'll hear more from Emily Parker, our registered dietitian, about that. But being active is also very important. And that means exercise in ways that help you keep your body moving and your circulation active. It also really helps with our insulin and our blood glucose. Taking our medications as prescribed, so following how our clinician orders and prescribes our medications, whether it's metformin, the pills, or if we are prescribed insulin injections, and also monitoring. So that's when we test our blood sugars on a regular basis, whether we're using the monitoring equipment that was showed to you, or using the technique of checking your blood sugar with pricking your finger and using a blood glucose meter. So there's different techniques, but monitoring and tracking it. Luckily, nowadays we have wonderful systems like the method, the Dexcom that Destiny was showing you, that it probably has a tracking system. So it probably stores the data, so that when you go to your clinician, you can show them what have your blood sugars been, the trends that have been happening with your blood sugars, and so that they can see, okay, is the medication we're prescribing working for you, or what do we need to alter or change? And that's where problem solving comes in. So if you're finding that your blood sugars are very high at certain times, maybe at nighttime or in the morning, or maybe your blood sugar is dropping too often and you're getting low blood sugar too often, what's going on? Looking at the foods you're eating, your exercise you're engaging in, your stress levels, and then problem solving. And then finally, reducing risks. And this picture here is of an eye exam chart. So being aware of your eye health, taking steps to not smoke tobacco, being careful with alcohol use. These are some things that you can do to help reduce your risks for the disease, to prevent the disease from getting worse. But being aware of all of these components are really important for the diabetic. And Destiny.
Thank you, Heidi. Yeah, as mentioned earlier, physical activity is just but one of the many things that we should consider when treating diabetes. So diabetics should be exercising and on top of eating healthy and also managing your glucose levels, because you could see a lot of the different ways that diabetics could exercise. Not every exercise plan is the same. So what might work for one person might not work for the other person, because blood sugars could drop or could elevate in certain activities. So also keeping in mind that diabetic nerve damage could happen, just depending on what kind of activity you do. I know for me, I try to keep it very minimal and not do too much. So one time I tried doing jump rope at one time and my nerve pain just went sky high and I could not do jump rope all at once in one session. So I decided to do yoga, minimal walking, some jogging, because diabetic nerve pain can really hurt, and it could lead to you hurting all around your legs. So just be cautious of that when creating your plan. I know I always have little visuals. So this is a little compression sock that I wear usually when I start feeling that my feet are getting a lot of pressure. So something like that is adapted that I could use for my exercise plan when I actually exercise. And always make sure to bring a glucose supply, whether that's candy or that's the like the new Baqsimi nasal spray that I showed you guys earlier, or just anything that has sugar in it, just in case your blood sugar levels drop. Because sometimes when you exercise, it could drop, sometimes it could be a good thing if your blood sugars drop, but you don't want to drop too much. So just learning how to regulate your blood sugars is really important. And just always having your medical supplies with you at any time, and especially if you have a medical alert or some kind of medical card to help people determine how to help you if something bad did happen to you. A lot of the times you could get a medical bracelet, or you could even have I think the iPhone has an option where you could have a medical ID on there as well. So just always keeping those things in mind when having physical activity.
Okay, we're going to share a short video with you. This is from Brennan. This is a athlete, Brennan Cassidy.
So my name is Brennan, and I have type 1 diabetes, which is an autoimmune disease where the body's immune system for some reason attacks the pancreas and it can no longer produce insulin. So my body, unlike most people, does not produce insulin to metabolize sugar. And so without insulin, sugar will build up in the bloodstream. So I have to take insulin, rapid-acting insulin. There's long-acting insulin, but I take rapid-acting insulin through basically what is an automatic pancreas called an insulin pump. And so I just wear this on my side at all times, 24 hours a day. I switch it out every 3 days. The best way I like to describe it is most people have an automatic pancreas. Their pancreas just works automatically. They don't have to think about it. And for me, it's just manual, like driving a manual car. I'm doing Ironman because I've always been an athlete, and I'm an athlete first and I have diabetes second. And I think a lot of people switch that around and they have diabetes first and the rest of their life comes second. And for me, I'm an athlete that just happens to have diabetes, and I'd like to prove that to a lot of people. Crossing the finish line to me means proving something to myself, to my family, and the whole world in general about that diabetes doesn't slow you down, that just because, let's say you're a child with diabetes, that it doesn't have to affect your life, it doesn't have to slow you down, you don't have to change who you are because of that, and you can do absolutely anything.
And on to Emily.
That video is so inspiring, and it makes me think, Destiny, what you said, and also hearing Brennan makes me think of one time my husband and I were out on the John Muir Trail, way up in the mountains, like by Mammoth Lakes. And we encountered a young woman and her brother, and the young woman has type 1 diabetes, but she wanted to do this whole John Muir Trail, which is like 300 miles through the mountains. And she used honey as her sugar source. So in her backpack, she had a huge honey bear right there at her side. So if her blood sugar started to drop, she would just squeeze honey in her mouth and then she was good to go. So the message with all of it is life is so possible and can be so rich, even if someone has a diagnosis of diabetes. So in terms of nutrition, you can see here, this is a very basic image. This would be the starting place if I were to be working with someone with diabetes. This image is from the American Diabetes Association, and this is a great guide for anyone who is at risk for diabetes, as well as someone who has diabetes. And what we want to emphasize here are fresh plant foods. And that's partly because they're full of nutrients, but it's also because of how they impact our intestines. And what goes on in our intestines and the microbes in our intestines actually changes how we metabolize sugar, which is kind of a mystery, but it's pretty powerful. So you can see here, if you were to be balancing a meal or planning a meal, you would want to have half of your plate be non-starchy vegetables. So this is all the leaves and the stems of vegetables. So this could be broccoli, it could be asparagus, green beans, also some things that have seeds inside like cucumbers, tomatoes, bell peppers, anything that's not starchy. And generally we want to have about 2 fists worth of those vegetables. So that can be a really good guideline. If you are looking at a buffet, try to fill half your plate or about 2 fists worth with just the vegetables. They could be cooked, they could be raw. We don't want to only have raw vegetables, so it's good over time to have a mixture between the cooked and the raw. And a place where you can add healthy fats into your meal is to add some olive oil to your vegetables. And the olive oil is very good for your heart and your body, and it also helps you absorb all the nutrients from your vegetables, whether it be from a salad or sauteed vegetables or drizzling olive oil over, let's say, a steamed vegetable. So moving to number 2 on the plate, you see protein foods there, and fish is emphasized in this image. We could also think of plant-based proteins like lentils, beans, tofu, soybeans, also other lean proteins like chicken or lean pork, lean beef. We want to try to go away from the fried foods and more towards the foods that are cooked without added fats. And the portion size would be anywhere from the palm of your hand and about that thick. So a not too large portion of meat, and that could be a little bit different from what you might be served at a restaurant, let's say. So just being mindful that our bodies don't need a huge amount of protein. And then it could also be something like a fist. So if you had beans, let's say, as a protein food, you could look at about a fist's worth of those, or a scoop of scrambled eggs, let's say. So the protein foods are important because they help balance your blood sugar. When you eat carbohydrates like bread or fruits, if you also have proteins at the same time, then the sugars enter your bloodstream more slowly and you have better control of the level of sugar in your blood. So protein is important to have with every meal, and even when you have snacks, you want to incorporate protein from things like nuts or seeds. Incorporating protein as a protein powder sometimes could be useful if it's like a recovery drink from exercising. But it's important not to have too much protein because too much protein can lead to kidney damage. So keeping to that quarter of your plate or about a quarter of the amount of foods you're having, especially for someone with diabetes, having too much protein could increase their risk for kidney disease. And we know that a person with diabetes is already at risk. So 2 fists vegetable, 1 palm to 1 fist protein foods. And then the last thing on the plate there is carbohydrate foods. So this encompasses both starches like potatoes, corn, sweet potatoes, breads, noodles, pasta, rice, tortilla, chapati, naan bread, all the different breads of the world, all the grains that we might encounter. It also includes fruits. So for someone with diabetes, we might spread their fruit intake out from their grain intake. We might emphasize grains at mealtime and fruits as snacks paired with something like nuts or cheeses. Or we might use fruit at breakfast time, but not have as much starches. So what we want to try to do is each individual has their own carbohydrate need, and each individual, if they're taking insulin, will have their own grams of carbohydrate that we want to try to aim for. So it's really individual in that case, but thinking about a quarter of the amount of food that we're eating. And that's very different from what, let's say you go to Panda Express and you're in line and you're getting served. Usually it's going to be at least half of that clamshell container is going to be rice, right? So if you were ordering there, you would say, I want half of it filled with veggies, light on the rice, and then choose your protein. You see how you have to kind of shift and make changes to the typical balance that we're given. Then number 4 is going to be water or another lower calorie drink. This could also be a calcium rich beverage like milk or soy milk, almond milk, but we want to emphasize not having added sugars in our beverages. So things like lemonade, sodas, even fruit juices most of the time would not benefit someone whose blood sugars are elevated. So really focusing on taking in beverages with no added sugars. And caffeine can also be tricky with blood sugar control. So Destiny is nodding her head because it could actually drop your blood sugars. So people who like to drink coffee or tea, they need to figure out if that's going to be safe for them and how their body responds to the caffeine intake. So really shifting towards waters, sparkling waters, those calcium-rich drinks. If someone wants to have something like yogurt or cheese, you don't really see that here on the plate, but the yogurt and cheese, if someone has Greek yogurt or let's say a mozzarella cheese stick, that would be used as a protein most of the time. And I like to use those with people for a snack because then it could be paired with a fruit. So that's just a really basic introduction. Of course, it would be nuanced and specified for each person. So let's go to the next slide. These are just the key points to take away. Choosing zero sugar beverages, I can't say that enough because so often people have things like boba tea, or they go to Starbucks or another coffee shop and have a sweetened beverage. They don't even think about, oh, this has a lot of sugar. I don't know if my body could handle this or not. So really starting with beverages as a first look, and then using that diabetes plate method in your mind, 2 fists vegetables, 1 fist to 1 palm of protein food, about 1 fist of starches, and then a 0 calorie or 0 sugar drink. With your snacks, it is important for some people to have snacks between their meals. So let's say they have breakfast, lunch, and dinner. If they're a very active person like Brennan, that athlete, or even Destiny on the days she's jogging, she might find that her blood sugars drop between her meals, especially if it's a high stress time like with studying. I don't know if you've ever experienced getting really hungry for sugar when you're studying. It's because your brain's actually using more glucose at that time. So if you're at a more intense time of your life, you might need snacks between your meals. And what we want to always emphasize is pairing things like fruits with proteins and or some fats. So you could also pair grains with proteins or fats. So this could look like the picture, apple and peanut butter, or it could be grapes with cheese slices, or it could be crackers with peanut butter. It could be hummus and sugar snap peas. But we work with each individual of what they prefer and then go from there as to planning snacks. A couple other points I wanted to make is the better nourished our bodies are, the better we're going to be able to have control of our blood sugar. So a key nutrient to be aware of for yourself is vitamin D. Vitamin D is part of blood sugar control. If your vitamin D levels are low, your blood sugar could start to rise. If we're able to correct your vitamin D levels, your blood sugar might come back down. So that's important, getting your vitamin D level checked and knowing if you need to take a supplement or not. The other point I wanted to make is that sometimes access to these healthy foods is very difficult, right? Fruits and vegetables could be very expensive compared to buying, let's say, chips and chicken nuggets, right? So that could be very real for a lot of people. So I wanted to make sure that you know that we have the beach pantry here at Cal State Long Beach. It's on the bottom floor of the Student Union. We also have CalFresh Outreach, which is through the Basic Needs Program, and it's a group of social workers and staff that will help you with the application process for what's called CalFresh Supplemental Nutrition Assistance Program, and that provides you with money to help you buy groceries. So if you're concerned about finances with food, I recommend that you check out that CalFresh Outreach as well as the Beach Pantry. And if you'd like more nutrition information, you can always make an appointment with me. I'd be happy to work with you.
Thank you, Emily. I appreciate that so much. So here at Student Health Services, we have resources for you. We have licensed primary care clinicians. We have a laboratory in-house. We have pharmacy here, and we also offer x-rays. And of course, Emily Parker, our registered dietitian, works here in the clinic, and she can offer both in-person and telehealth visits. We are going to be offering a health advocacy workshop March 14th from 1 to 2 on Zoom, and that will go over information about how to get insurance, and we will have a guest speaker, Faye Mayo, who is one of our nurses, who will provide information about how to get enrolled with Medi-Cal. There's something else that I think is really important, that if you are a diabetic and you need to have use needles, something really important that Destiny has done as one of her projects is getting sharps containers that are in all of the restrooms in the student union. So if you are a diabetic and you need to dispose of your sharps or needles, you can put those in those sharps containers in the USU. And thank you, Destiny, for doing that. So a little bit more about our assistance and accommodations that Cal State Long Beach provides. Diabetes is covered under the American Disabilities Act, and that means that a person would qualify for accommodations through the Bob Murphy Access Center, also known as BMAC. They're located in the central part of campus at the Student Success Center. And their website has lots of great information with an email contact and phone number for more information. And of course, our Student Health Services, SHS, we are your on-campus medical clinic. We also have a social worker on site and a referral nurse, and they can help you with assistance to off-campus care if necessary. And then we have the Counseling Center, CAPS, which is located at Brotman Hall, and they offer counseling and support groups. And when I talked about coping earlier with a diagnosis of diabetes, it might be very helpful if you are diagnosed with diabetes to talk with a professional to find ways of coping emotionally with your new diagnosis and finding new ways to manage stress. And then, of course, as I mentioned earlier, the USU has the sharps containers in restrooms. And a student could always use our sharps container here in the clinic as well, which we have in every exam room. This is a list of all of our references that we use to develop this presentation. And if you are interested in getting a list of these, you can always reach out to us. And finally, I'm going to go ahead and let Destiny take over here.
Yeah, thank you guys for reaching all the way to the end. All this information is super important because knowing the risks of diabetes is really important because you could prevent it, or at least kind of push back the bad things that could happen with diabetes. So knowing earlier and getting educated about it sooner is more better than learning about it when it's too late. So when we have all these resources on campus, it's really easy to be able to have access to knowing if you have diabetes or not. So please, please, please take advantage of these resources, and they're free. If you're a student here at Cal State Long Beach, a lot of these resources are free or reduced cost. So I hope that this could kind of educate you, and not only advocating for yourself, but even advocating for others that probably don't know about the realm of diabetes and how it could happen to anybody. So yeah, there's also a survey that we're going to put to see how at risk you may be for diabetes. It should be in the chat, and you get to see if you are prevalent to get diabetes or what kind of diabetes you might get. So hopefully you could definitely fill that out and see for yourself. But thank you guys again. And this is a really important topic, so thank you. If there's any questions, definitely put them in the chat. But it's a lot of information, so definitely if you want to take your time to put a question, go ahead and do so.
And Destiny, can you go ahead and pose those questions to our group of experts?
Okay. The questions, I don't think I see anything in the chat yet.
Okay, no questions yet. All right, well, we'll go ahead and give everybody a minute or so. If they want to go ahead and put something in there, that'd be great. I think I see a couple things coming up.
Yeah. So very informative. Thank you for all the information, and then thank you for all the information. And this is great information. Yeah, so the purpose of this workshop was to really bring education, because education could probably, it's its own form of advocacy. So just giving you guys all this information, all the tools that help you be successful really does a good thing for our community. So we're really glad that you guys enjoyed it.
Wonderful. All right.
Nubia, there's one question that just popped up. So
Great.
Nubia, another one too. So Nubia had said, what would you recommend to someone who has up glucose intolerant various times on a glucose intolerance test?
I can answer that. Basically, glucose intolerance is what they consider to be what's called pre-diabetic now. So it's still the same approach. You're going to monitor yourself. Even in a pre-diabetic state, you can get the glucose monitors, and you can check yourself multiple times a day, before you eat, after, when you wake up. Of course, you're going to start a diary and record all of that information. And it's not too early to embed the dietitian and start working on your diet, and as well an exercise program. Because in most instances, pre-diabetics do progress into having diabetes. And that's determined by your labs, that hemoglobin A1c. There's a point where they consider you to be pre-diabetic or glucose intolerant, or when you're considered a diabetic. And the treatment is the only thing that would really change. You would either need to go from being on pills or even some injectable type of insulin. But you still would do the diet and exercise, and you still would have the goal of having daily management of your glucose levels. So it's not like a recommendation, it's more of a monitoring, self-monitoring. Be your self-advocate, watch yourself, talk to your doctor, embed all of the coordinated care with the dietitian. I like to talk a lot about the different ways to implement exercise. You don't need to go to a gym. You can do something very simple at home and do some sort of exercise and burn calories. So it's just monitoring and watch yourself, and make sure you get your blood test regularly. So I hope that answers your question. If you have anything else, let me know.
Yeah, thank you, Rosemary. And there's another question as well. It says, curious if you have considered a student organization revolving around diabetes. So Heidi and I were actually talking about that earlier. So that could be a future project that we could definitely do, but I'm gonna put in the chat. There's a network of people that are, diabetic. So it's called College Diabetes Network. So they kind of have like an internship that kind of does exactly what you just said. So they're kind of like evolving around diabetes and kind of advocating for healthy living and with diabetes and stuff. So thank you for that question. Really good. Maybe a future project. And I think that's it that I see so far in chat.
All right. Well, excellent. Thank you so much, Destiny. Thank you, everybody, for being here. Thank you, Rosemary and Emily. So appreciate your input and your help with this project. And if anybody has other questions for us, you're always welcome to email myself or Rosemary or Emily. I can always field those emails and make sure they get to the correct individual. And a great email address to send questions to is wellness@csulb.edu. And I'm the one that answers those, and I'll make sure they get forwarded to the appropriate person. If you have other questions, if you want to schedule an appointment at the Student Health Services, you can always call us at 562-985-4771, or you can check out our website for more information, which is csulb.edu/SHS. So thank you, everybody, for coming today, and we look forward to maybe seeing you at our next event on March 14th, the Healthcare Advocacy event. Thank you.
Goodbye, everyone.